I think we're live. Hi,
I think
my
so.
name is Rasheed. I am the Marketing and Communications Coordinator here at Crohn's and Colitis Canada, and I'm very honored and pleasured to be joined tonight with Carly Lindsay. And Carly here is going to be talking, and a little bit from me as well, we'll be talking about living with an ostomy. Really hope that you can enjoy the conversation that we have. Join in on the conversation, ask your questions in the comments below, and we'll get to as many questions and comments as we can today. So over the course of the next hour or so, maybe a little bit more, maybe a little bit less, we're just going to be talking about all things related to life with an ostomy. So if you have any questions about what it's like day-to-day living with an ostomy, what ostomy surgery is like, and if you have any experiences of your own that you want to share from your life with an ostomy, we'd be happy to hear it. So let us know in the comments thread down below the video. We'll get to as many questions and comments as we can throughout the night, and you'll get to hear from the experiences of both myself and Carly. So Carly, again, thank you so much for being with us here tonight. A little bit more about Carly Lindsay, who is a past AbbVie IBD scholarship recipient. She's a volunteer with the Ostomy Canada Society, as well as a registered nurse and a clinical instructor at Queen's University. And she is currently training to become an enterostomal therapy nurse and has been living with an ileostomy herself since the age of 9. And we were talking earlier, I don't know what more training you need at this point, Carly, to get that designation, but glad that you're going through all the proper channels, and thanks again for being with us here tonight.
Anytime. Excited to be here.
So I guess for starters, maybe Nurse Carly can answer the first question, which is if you can explain for the people who are new to ostomies, just what exactly is an ostomy and how does it work?
Yeah, so there are 3 types of ostomies, actually. So the first one doesn't quite apply to IBD in particular. It's a urostomy, so it diverts your urine. So the other 2 are an ileostomy and a colostomy. So basically with those, it just reroutes your plumbing. So in my case, I have an ileostomy, and they took out my entire large intestine due to ulcerative colitis, and they rerouted my plumbing, so I don't actually go to the washroom through my bum anymore. I go through what is called a stoma on the outside of my body. So it's a little piece of my small bowel that they've kind of taken through a hole in my stomach, and they kind of turtleneck it, cuff it over, and stitch it to the skin. So my stool now kind of exits my body at whatever time it wants. I don't have any control over it. But what I do have control over is the pouch that I wear and the amount of time that I get with my ostomy appliance. So it gave me a lot of control and quality of life back after my surgery.
Very cool. Now, I read somewhere, and I guess, again, Nurse Carly can correct me if I'm wrong, the actual stoma itself, is it the same sort of tissue that you find on your tongue?
It kind of looks like it, yeah.
Yeah.
Okay, same like a mucosa.
I do remember reading that from a book by Julie Devaney called My Leaky Body, and she sort of saw her stoma as a way of giving a little to the rest of the world and to IBD in general to say, like, you didn't beat me, I'm still here with my stoma. So another little bit of information on the side there. So you mentioned that you had ulcerative colitis, and that's what sort of led to having the ostomy. Could you tell us a little bit more about the quick transition from symptoms to hospital to the surgery to life with the surgery, and the short time frame that happened for you?
Yeah, so I was diagnosed at the age of 9. I had about, 2 weeks of symptoms. It started with like kind of an ache in my knees, and then it translated into the bloody diarrhea that you typically see with bad ulcerative colitis. So it kind of manifested into me going to a family doctor, getting referred to a pediatrician rather quickly. And then from there, they thought I had the superbug C. difficile, which also causes bloody diarrhea, and put me on a bunch of antibiotics. And the antibiotics, I don't know what they did to my colon, but it didn't agree with it. And all of my symptoms got a million times worse. So from there, it was a trip to emergency. And then from our kind of local emergency, I was referred to McMaster Children's Hospital, and I spent about the next 6 weeks there. So I was admitted there. They confirmed that I did not have C. diff. Did a colonoscopy, a couple barium tests, and they were like, yep, you have ulcerative colitis. Put me on a whole bunch of steroids that really didn't work for me. The only real kind of sign that they were working was the big chubby moon face cheeks that everyone loves. So once it was established that the drugs weren't really working for me, my only options were more drugs, which I had worked out that I would be on drugs until I was 24, which seemed really old at the time. And now I'm 25 and I'm like, oh, it's really not old. Or to have surgery. And when they presented surgery, it was, you're going to go in for surgery, you're going to have this ostomy bag, but you can go home a week after surgery, you can eat, you can kind of live your everyday life as you would beforehand, before the surgery, but you won't have to be running to the washroom every single day. You won't have to be running multiple times a day. You won't have the bloody diarrhea. So it was a lot about more of my quality of life versus maybe taking medications every day or dealing with those side effects.
Right. And I think especially from the steroids, as you mentioned, the moon face is definitely one that's a very obvious side effect. And as I'm seeing some comments now coming in from the folks watching, Lorna King, steroids are camouflage, which is exactly it. I mean,
Exactly.
It's not really like treating the disease really at its core. So
it's inflammation.
Exactly. It's a difficult drug to be on, again, not just because of the facial swelling, but a number of other side effects that can come with it. And so just getting back to some of the other questions that we've had come in here from Holly, and I think you did mention this, how old were you when you got it, and do you feel any better? So we'll get to the feeling better part. Just to reiterate, you were 9 when the surgery happened. And so, again, to your recollection, you said, yes, let's do it. I'm ready to do it. Like you weren't somehow like coaxed into it. It wasn't an emergency situation, but you felt like, yes, surgery.
No, it was, I was laying in a hospital bed. I was getting up 20 something times a day, trying to run to the washroom. There were times that I was already like mid my low hemoglobin run and my IV pole was still plugged into the wall. So my mom's like running around the bed, trying to unplug the IV pole as we're like trying to run to the washroom. So it wasn't fun. I couldn't eat anything. I was on clear fluids. I had, I think 6 blood transfusions while I was in there. I honestly waited until my hemoglobin got so low that I needed blood transfusions because I loved the feeling of having a hemoglobin over like 80. It was like it was fabulous. I was on TPN. I had a PICC line, loved my PICC line because they didn't have to poke me for needles anymore for blood work. So when all of that was, if you have the surgery and then in a week you can go home and you can eat normal food and eventually kind of go back to school, I was like, yeah, let's do that. That sounds fabulous. So I think in a sense, I kind of convinced my parents into it. I think they would have gone either way, depending on what I wanted. And I'm sure that they kind of shaped my view of what everything was, and they were supportive of everything. But I really wanted surgery. I just wanted to feel better. I was tired of feeling terrible.
So wanting to feel better is obviously a big part of it. When you were in the hospital, did you get a lot of information about what life would be like with an ostomy, some little introductory practice with a bag beforehand? Because I remember getting that before going in for my surgery. So what sort of training did they offer you while you were still in hospital before and I guess soon after the surgery?
The surgeon obviously came, they talk to you and they tell you, there's risks of this and these are the benefits and this is where your stoma will be. This is kind of what you'll live with. The surgeons, they know it really good from a surgical perspective, but for me, it was really my ET nurse, so my ostomy nurse, enterostomal therapy nurse, that came in and really kind of grounded what living with an ostomy would be like. It ended up that her mom had one, so it was really, really relatable of this is something that people actually live with, opposed to this theoretical rare something that happens to people. So she came in and talked about her mom and those experiences, as well as she brought in all these pamphlets of kids at the Ostomy Canada Society youth camp, which is out in Alberta. There's a picture on my fridge. Kids rafting. But she showed me all these pictures of these kids that were running around. They're wearing, jeans, they're wearing shorts, they're wearing bathing suits. They're climbing rock walls, they're whitewater rafting. They're out at campfires, they're out being kids. And that was kind of a changing point for me where I was like, wow, this is actually something that I could do. Like this is an attainable, like realistic thing that could happen and make my life a lot better than it was at that point.
And I think your story is resonating with a few people, especially one here from Ian. Stories are similar, however, diagnosed with UC 3 weeks after he turned 40, and he's 44 now. And no drugs worked for Ian. Control removed, I'm going to say colon removed in 2015, and Ken butt in 2016. So yeah, again, for folks that are unfamiliar with some of the ostomy terms, Ken butt and Barbie butt are typically the terms that are used for describing sewing up the anus when it's no longer needed, when it's no longer in use. But Ian, thank you so much for sharing your experiences and your story with us. Getting to some of their comments and questions coming in here from our friend Vegan Ostomy, who had a wonderful stoma nurse, and yeah, that does make a big difference. And I guess, Carly, your experiences maybe led you to the career path that you're now on, and the next level of your nursing career that you want to go to, which is great. So now, was there anything around the surgery or soon after that you were worried about when it came to living with an ostomy?
For sure, like the immediate post-operative kind of concerns. I woke up with an NG tube. I woke up with an epidural. I woke up with a catheter. My epidural didn't work, so I was in a lot of pain. My NG tube, because my surgery got moved up a week, I actually had a cold when I went into the operating room. So, like that phlegmy mucus cough, I had that with my NG tube. And the nurses were like, oh, everyone complains about their NG tube. Like, no, mine actually had a loop in it when they put it in.
Everyone complains about the NG tube because it's terrible.
Yeah. Yeah. And then they always come in and they make you get up and you're in so much pain and you don't want to sit in the chair. And I was in grade 4, so they tried to motivate me with doing homework. I don't know why anyone thought that was a good idea. Don't ever try and get someone up to the chair by like saying, let's do your homework. Like maybe let's watch a movie, or like have your dad bring an ice cream. So those were kind of first things that I was like, what did I get myself into? But after that, I think I went home 6 days after surgery. And the best day was definitely when my parents brought homemade noodles, which was my favorite food, like plain noodles. And after that, it got quite a bit better. I was still off of school, I think, for about 2 weeks. And a lot of it was just trying to tell kids, like, kind of what happened to me. A lot of them knew that I had had surgery. But the rumor going around the school was that I had both of my legs chopped off. I don't know how, like, losing my intestine translated to losing both of my legs instead.
It's a really extreme broken telephone case.
So when I showed back up at school, everyone was like, wow, she can walk, like she has legs. And I was like, yeah, like my legs were never the issue here, guys.
Very strange.
So those were kind of some concerns coming back. But
and so yeah,
kind of face them as they come. And then a big one for me was that in grade 4 in Ontario at that time, we did swimming lessons. So the swimming lessons actually started 6 weeks after I had surgery. And I was like dead convinced that I was going. My mom was not totally on board, but I proved all of them wrong. I got my surgeon's permission to go swimming, and I proved my mom wrong, and she took me every single week and did swimming lessons 6 weeks after. So just, I don't know, overcoming all of those things was big at first, and they're big kind of moments at the time. And now I look back at them and I'm like, why was I scared to go swimming? Like, that seems silly. But they're common things that a lot of ostomates think and face.
And just having a look again back to some of the comments, I guess some people are seeing a little bit of a lag in the video screens, getting a little bit of that myself here. So apologies for any delays that you may get with the video, but we're doing our best and we'll keep going along and getting to as many comments as we can. So to that effect, from Zoe, 14 years of an ileostomy with Barbie butt, and it saved my life due to Crohn's. Ostomy gave me freedom and life again. Best choice I made back when she was 23. And from Cheryl, diagnosed in October 2016, surgery in February 2017. So again, pretty quick turnaround between diagnosis and surgery. Barbie butt, but a lot of complications. No chemo, no radiation because I have chronic renal failure and diabetes on top of that. So a difficult case, Cheryl, and obviously our best thoughts to you as you're dealing with all of that, and stay strong through all of that. And just a nice little comment from Peter. You're an inspiration, Carly.
Oh, Peter.
And Yeah, you wanted me to highlight that one, I'm sure. But I think that is a very true say. So again, thanks to everyone for the comments and the questions. We will get to as many as we can as we go on through the night here. So getting to just talking about what made you adjust to life with an ostomy and what helped you with the transition. Again, you mentioned like the swimming lessons, just wanted to get back out and do the normal things again. So what are the things that would you maybe recommend to someone else in making that transition to life with an ostomy?
I think definitely having a support network. I mean, I was 9, so I obviously had both of my parents. I had my brother. I had some really good school friends. One of my best friends growing up, her mom actually had Crohn's. So everything that I was kind of going through, her mom had also gone through. So it was pretty relatable for her. So she was someone that really supported me through all of that. Another thing, going back to school, a lot of people I was really terrified of like bathroom stalls and having, that open area at the bottom or like the slits where the door and the wall meet. So working with my elementary school, they found, or they already had, I just didn't know about it, but they had more of like a wheelchair accessible washroom that actually was its own enclosed room. So I got to keep a spare pair of clothes there, spare ostomy supplies, and actually go to the washroom there if I didn't feel comfortable in kind of more of the public bathroom setting of our elementary school. So I think accessing any of those services, if you're in school or in your workplace, if you're older and not in school, to have those kind of resources available to you. And you learn a lot through trial and error. So things like I have it with me out here ready for the talk, but I always carry a bag with an ostomy supply in my backpack. I carry it to work. I carry it in my purse. It's nothing fancy. It's an ostomy bag in a Ziploc bag. So just 2 bags that I carry around all the time. But having those with me at all times. And I don't carry spare clothes around with me anymore. I don't do any of that kind of stuff. But in the beginning, those were things that I definitely did, or my mom was very conscious to have with her instead of with me.
Mm-hmm. And just a little story for myself, because I had an ostomy as well, a temporary one for about 9 months in between surgeries as well, as a result of ulcerative colitis. And I too, in my backpack, carried all of the ostomy supplies. I had a couple of spare bags, a couple of the spare plates, everything was ready. And I did need it very badly on a trip to Niagara Falls, where I was not expecting to have an ostomy blowout, but I did. And I needed to make the change. I needed to change clothes. And my girlfriend at the time was very supportive and actually ran to a gift shop to get a new t-shirt and a new sweatshirt for me, so that after I made the ostomy appliance change, I had some fresh clothes to put on, and that kept me going the rest of the day. So, difficult things do happen. And, to that effect, I did get a comment in from V, who maybe have had some problems with blockages as a result of having the ostomy. So I guess maybe first of all, Carly, if you can explain just what is a blockage when you have an ostomy, and is that something that is kind of common, and how do people deal with that?
I would definitely say that they're common. So blockage is when something gets blocked in your intestine. It's a little self-explanatory, but sometimes it's food. Sometimes it's just the way that your intestines kind of settle, that they have a bit of a kink in them, so they narrow and something gets stuck, or you move kind of the wrong way and it settles the wrong way for a bit, and then you don't eat or you get nauseous, and it kind of can resolve itself. They were really common for me when I first got my ostomy. My mom literally used to sit at the kitchen table and count the number of times that I chewed my food. She also used to have like measuring cups on the stove of how much water I needed to drink every day to make sure that I was hydrated enough. So my mom was maybe a little over the top. But for sure, in the first little bit, there were quite a few emerge visits, just because when you get a blockage, nothing. So you end up with this kind of abdominal cramping, nausea, end up vomiting kind of symptoms. So good things to try and kind of avoid them. Obviously, chewing your food, drinking a lot of water, making sure you're hydrated are kind of big ones. Exercise can also help a little bit. Once you actually have one, make sure you stay hydrated as much as you can, drinking those electrolytes, getting those salts in. things to kind of help it move along if you can stay walking. My mom used to make me do stairs or like lay on the floor and do like the bicycle type things, warm bath, heating pad, just things to kind of help the cramping move along, because eventually it should pass on its own.
So blockages, again, a little bit common for folks with ostomies, and some good tips there on how to deal with it. What other challenges have you faced as a result of having the ostomy? I think just from, I guess, a technical standpoint in terms of the appliances and day-to-day life, what other challenges have come up for you?
I have been really lucky, to be fair. In terms of ostomy appliances, I've worn the same type of pouch for, oh my goodness, like 8 years now. So my skin has always been really healthy. I get a really good wear time. So an average wear time for an ostomy bag should be about 4 to 7 days. Varies for each person. Some people get 2 days and they're like over the moon. That's great. I personally get around 7. So it gives me a lot of security that way. But, oh, where was I? What was the question?
The challenges of having an ostomy.
So like skin challenges, I haven't really had any, but I know that they are really common for people. A lot of people do get kind of that redness and that irritation, whether it's kind of an allergic reaction to the pouch or if their skin is kind of wet and moist from the stool that's sitting under it or leaks. A lot of people kind of deal with those issues, and just go see your ET nurse. She'll fix you up, hopefully. And I mean, in the beginning, there were a lot more challenges for me. I used to not have as reliable of an appliance, so I did experience a lot of leaks. Or when I first went home, my mom used to set an alarm in my room for 3 a.m. so that I would wake up and go to the bathroom and empty my pouch, because otherwise I would sleep through it and it would literally just like explode off because it was so full. So yeah, you learn fast after a couple of those. Absolutely. You have to wake up, laundry, and but luckily now that I have it down to an art, I don't experience a lot of those things anymore. But they were for sure challenges in the beginning.
And what about gas buildup in the ostomy appliance? Again, this is a question that came in from Michael. So again, yeah, when gas gets built up and it's coming out through the ostomy, again, it can inflate the appliance. So what are some things that can be done to maybe counteract the gas buildup when you have an ostomy?
There's some food things that you can try. I'm sure if you Google, I feel like Vegan Ostomy wrote an article about this. I'm not sure. I remember reading it for the ET course. And there's a bunch of foods that are kind of known to cause gas. So like carbonated drinks, beers, apparently a really bad one. Those kind of things. So if you can eliminate some of those from your diet, or maybe just not eat them so close to bedtime, might also help for at least overnight production. There's also bags with filters. I know they're not the most reliable of all filtered things. They do get clogged, but for the first little bit, they do work. And they do filter out the smell for the most part, just so people know. But those are kind of my tips and tricks. I know a lot of people change not a lot, but some people change what time they'll eat their dinner. So I tend to not worry about it, and I just eat whenever I'm hungry. But there are people that I know that don't eat after, say, 5 or 6 p.m. They don't have like a bedtime snack, so to say. Like they eat more during the day and then have more of like a fast at night so that they don't have as much output. Okay.
So we'll get to a few questions because a number of them have come through. And again, thanks so much for the questions and for the comments that have coming in through our Facebook chat tonight. So one from Ed in terms of regular exercise. So once you're back and you're out of hospital, you maybe want to get back into a physical activity again. Did you find it hard at all to get into any sort of exercise after your surgery? Or even beyond that, once just you had your ostomy day to day?
I didn't find it that bad, I think, because I was really acutely sick and then I was just so much better feeling after my surgery. I kind of jumped at the chance. It took me quite a while to get my energy levels back. So, for example, didn't actually pass my swimming lessons in grade 4. But the point was that I was there. It wasn't actually to pass. So I did reach a goal. It just wasn't the goal maybe set out by the swimming lesson instructor. So it did take me a bit to get back. I started ballet again after my surgery. So I did ballet for about 12 years total. Started that again. In terms of actually exercising, I'm not a super, I'll call it athletic person. I do like to go to the gym. I like to work out. My workout's not that intense though. But that being said, when I went to Everest Base Camp with the Intestinal Disease Education and Awareness Society back in grade 11, they put me on a really intense workout program. And it did take me a bit to adjust to that. It was like running 5 kilometers every other day, and then this like high intensity, it's called the Spartacus workout. That's a lot of like planks and push-ups and squats and awfulness. But it worked. It was really beneficial, and I did see a lot of benefits from it, but it did take me a long time to get into it. And I did have to make some kind of modifications while I was doing the program. Just because my abdominal muscles aren't quite as strong as maybe they would be if I didn't have previous surgery.
Mm-hmm. I think for anyone that's sort of fresh out of surgery, the key is to not push yourself and not do anything too strenuous right off the bat. I think usually there's a 6 to 8 week waiting period before you do anything, even remotely active. And then even when that does start, it's important to just ramp it up slowly and listen to your doctors and your nurse's advice when it comes to recovering post-op. So some other questions from Diane. Any tips for what to wear under clothes? I'm guessing when it comes to just clothing in general, I know you mentioned earlier, you saw pictures of people wearing just jeans, shorts, like regular attire. Is there anything that you do to alter your wardrobe at all as a result of the ostomy, or to help keep things in place?
I don't think there's anything specifically. I mean, I wear more of like the high-waisted type jeans. They generally come up to like my belly button. If she wants me to show, I can stand up and show you guys. But they're also in style right now, which is great. But I generally wear jeans that sit around my belly button. My stoma is kind of lower in between like that hip bone and my belly button. So it's a little bit easier to cover than others. I wear like high-waisted bikinis, although I also wear low-rise bikinis when I'm with my friends. I don't tend to wear them out in public just because I don't like answering everyone's questions. I'd rather just be there with my friends. Not that I don't like answering the questions, but it's easier to enjoy time with your friends. This, right? But I do wear low-rise bikinis as well. In terms of like undergarments, I just wear regular underwear. Back when low-rise jeans were more in style, I used to have they were just like this pair of Spanx shorts. They weren't really like Spanx in like the compression sense. They were just like spandex shorts that I used to wear they would come up to my belly button as well. And I would wear those under my low-rise jeans just to kind of hold everything in place. And then if I were to like reach up and grab something on a shelf and my shirt were to rise a little bit, it just looks like I'm wearing like a black tank top or something else tucked into my jeans. I just like that kind of security feeling of having it close to my body.
Right. And so one thing I've noticed from the comments that are coming in here is I actually see a lot of people who are asking questions and then other people in the comments thread who are answering those questions. So thank you for doing our job while we're out here talking. But we will get to a couple of the other questions as well. I know I did see that this has kind of already been answered, but maybe a good question just in general for everyone. You don't have to get into specifics as to what kind of appliance you use, but for someone who's got an appliance that's leaking a lot and has to change it on a more regular basis. I mean, you said 4 to 7 days is the kind of wear time that we want to get out of an ostomy appliance. But if someone's having to change it every day, what sort of tips would you have for someone like that?
I would say to contact your ET nurse, so your ostomy nurse. If you don't have one, just contact your surgeon's office, and they should be able to put you in touch with one. Also through like home care. So for those of us in Ontario, the LIN or the CCAC. They also have ETs on staff. There's a million different types of pouches. Might be a slight exaggeration, but there's a lot of different choices, and it does take a while to figure out what works for you. I remember back, I think I was in elementary school, but they discontinued the pouch that I was using, and I had a full meltdown. I was crying, and then had to try a whole bunch of products in the meantime, and it was awful. Some of them worked really well, and I found one that worked, but some of them, they didn't. And You wear them and you're like, nope, I can't do this, or it's not sticking to my skin. So you find what works. And if you don't call your retainers, they'll have a bunch of suggestions for you. You're still gonna have to do some of that trial and error kind of thing, but sometimes they can pinpoint where it's leaking from or why it's leaking. Maybe there's a little bit of a crease in your stomach, or when you sit, there's a little bit of a bulge and you have to fill in some cracks and crannies with like a ring, or maybe some convexity depending on kind of your belly. So convexity is just kind of almost like a bump in the back of the pouch that adds a little bit of pressure. So kind of adding and tweaking those things can help a lot.
Good tips, all good tips. Something else that came up earlier as I'm trying to go back through the chat here, there was a question about the different kinds of ostomies. So, I mean, sometimes we get a little confusion when we talk about ileostomies, whether they're permanent, whether they're temporary, and sometimes people do confuse ostomies and pelvic pouches as being one and the same, and the two are clearly different. So I just wanted to see if I can find the original question, and it came from Nikki, who, again, first of all, thank you to Carly for sharing your story and inspiring people. And the difference, and the question here, the difference between a temporary pouch, permanent pouch, and internal pouch. So, and again, we use the term pouch and ostomy and pelvic pouch interchangeably, and that's not always the correct thing to do. So maybe, Carly, if you use just for a minute, explain the difference between a temporary ileostomy, a permanent ileostomy, and the difference between an ostomy and a pelvic pouch.
Yeah, so for a temporary ileostomy, which is technically what I have, in that surgery, it's usually kind of a 3-stage surgery to a pelvic pouch. So in the first stage, for an ileostomy, they'll take out most of your colon and they leave your rectum. So they leave usually about 6 inches, I think, still attached to your bum, to leave there to maintain those sphincters so you have control when they reconnect you. So then from there, you have a temporary stoma. So it's still kind of an end. It looks exactly the same as a permanent one from kind of an outside body perspective. And then from there, you'll heal for usually about 6 months and then go in for a second procedure. And in that one, they will take your small bowel and they actually make a pouch out of it. So the most common one that people know of is a J pouch. So they kind of take your intestine, and if it's a tube, they kind of cut it open so it's kind of flat more, and they will make a tube out of it. And then the rest of it will attach to your bowel, and then they will attach the other end to your rectum, so that they will eventually have kind of the stool flow through there. And then for that one, you're also still left with a stoma, just because there is a high chance sometimes that the pouch stitches don't always hold. So we want to make sure that that's really nice and healed before we start putting poop through it. So then in the final surgery, they just close up that final stoma and reroute the stool. So instead of going into the external pouch in the ostomy bag, it goes into the internal kind of reservoir and then out your bum. So that's a temporary one in kind of a nutshell. And then for a permanent one, what they do is instead of just taking out just the colon, they'll take out the colon and the rectum as well. So that's where you get kind of that Barbie butt or that Ken butt that we were talking about earlier. So there you literally have an incision kind of at your bum hole. So instead of having a bum hole, you have an incision. And then there's nothing else that they could possibly kind of connect your intestine to reroute your stool back through your bum. So it comes out into your ostomy bag on your stomach.
Great. Yeah, great rundown of everything. And I guess while we're on the technical terms, one more term that maybe doesn't get used as often, but is still very important, is a colostomy. So it is possible to have an ostomy that is just a part of your colon or your large intestine that's, again, coming out through your skin and then waste collecting into the bag outside of your body that's attached to the skin. So ileostomy, colostomy, pelvic pouch, we're going through a number of terms here. So we're doing our best to keep everything organized and everything on track. And I think maybe now a good chance to bring up the bit of a debate, I guess, in terms of a permanent ostomy versus a pelvic pouch or a J pouch. And this was a question that came in earlier from Tanya. So thoughts on having the J pouch for someone with a current ileostomy, and that is $1 million question, I think, for a lot of folks who have an ostomy and may be candidates for pelvic pouch or J pouch surgery. So I, as someone who've had the ostomy and a J pouch, can speak to maybe having both. Carly only ever had an ostomy, and I'm going to guess you're pretty good with that. So any rationale for just wanting to keep things as they are?
I was supposed to be like a J pouch, pelvic pouch procedure candidate, especially being so young, and my health kind of rebounded so fast after my ostomy that they really tried to push it, as I say everyone does, and everyone wants to be normal in a sense and go to the washroom normally. And for me, my kind of normal at like 6 months to a year post-op was, this is great. My life is great. I have all of this control over my bowels. I'm back at school. I'm back at ballet. Like, I don't have any real issues with my ostomy. I was coping really well. I had made a lot of friends at the Ostomy Canada youth camp. So I coped really well with it. And I had been so sick prior in the hospital that I really just didn't want to risk going back there. That just wasn't a priority. I didn't want to eat Jell-O again. I didn't want to be on chicken broth and ginger ale. I didn't want to do that. I didn't want to be in the hospital. So for me, it was more about just keeping that quality of life. And I never really had any kind of what if moments. And even now, I still have them every once in a while when I try on a bathing suit or something and it doesn't look great, or I try on jeans and they don't come up quite high enough. But then my friends just laugh at me and they're like, well, Carly, I picked the wrong size of jeans and I can't even get them on my thigh now. And so like, you're really like, it's not a big deal for me. I've really adjusted to it. I'm very open, and I've had a lot of really positive experiences come out of having an ostomy for me. As we talked about earlier, it's kind of guided my career path into nursing, and provided me a lot of opportunities that I wouldn't have had. So I do value my ostomy.
And I think just from the other perspective of someone who's had both the ostomy and the pelvic pouch, again, I'm really happy with the pelvic pouch and the J pouch. I think it's opened up a lot of possibilities for me as well, but I don't think that there are possibilities that I necessarily wouldn't have had if I kept the ostomy. Just in general, both the ostomy and the pelvic pouch are great procedures to go through in terms of just helping you achieve better health. And it comes down to whether you're comfortable just carrying on with the ostomy. I think, obviously Carly is a great example of doing just that and being just fine. And, I have the pelvic pouch and I'm doing fine with it as well. And I'm very happy for the decision that I made. And I think for me, knowing that I've had that experience with an ostomy, if for whatever reason the pelvic pouch doesn't work out for me, and there is, a slight chance of that happening with everyone, I know that if I go back to an ostomy, like, I'll be good. I'll be able to carry on, do all the normal things that I would before. And I just have this little slightly different way of rerouting waste out of my body. And I mean, that's really ultimately what having an ostomy comes down to. And for having a pelvic pouch, again, the appliance is gone, but the bathroom trips are still a little bit more frequent than an average person would be. And actually, there have been times after having an ostomy and then living with a pelvic pouch where I actually kind of thought, man, it'd be kind of nice to have an ostomy right now because I could hold things in a little bit better, a little bit longer. So, I mean, there are advantages to both. And I think it comes down to personal choice, whether you want to carry on with an ostomy if it's working well, or want to give the pelvic pouch a try because, it can work well as well. Sure. So again, thanks again for the questions that have been coming in. And just some earlier stuff that Carly and I had been talking about in terms of, having an ostomy, even potentially having a pelvic pouch when you're talking to new friends or potentially a relationship. So how do you bring that topic up, and how do you let someone know, hey, so here's this one thing that you probably don't recognize about me because you don't see it, but I have an ostomy. So how do you have that kind of conversation with someone?
I think for me, I try and bring it up really naturally and kind of try and relate it to something else in the conversation. Maybe a little bit easier for me because I work in healthcare. I work as a nurse. So it does come up really easy but obviously in high school that didn't come up. So just kind of bringing it into the conversation, or even when I had sleepovers in the beginning, my mom would tell my friend's mom, and then my friend's mom would somehow tell like some details to my friend. So my friend like kind of knew what was going on, but like didn't really know. And I found that kind of approaching them and saying like, hey, I have this ostomy, like it might leak tonight. It's a potential. But like it should be fine. And kind of approaching it that way and kind of being, for me, straight on and really honest about it, really comes across. I'm really comfortable with my ostomy. I'm happy with it. And I think that that attitude also comes across when you're telling people. There are a lot of people that think that they're gross or that you smell funny. Those kind of things are always in people's heads. But I've never had anyone actually tell me that, at least not to my face. And even my nursing students, we talk about ostomies all the time in our curriculum, and they all think that they're these old people that smell, and it's not true. And then when you're like, oh, I have one actually, and they're like, oh, do you? Because like you don't fit the profile that I had in my head. So kind of bringing it up as naturally as possible. Sometimes I've had a friend they were just looking and saw it on my stomach as I was reaching up to get something, or if it was a little bit puffy under my shirt, and they're like, Carly, like, why is one side of your stomach bulging out and not the other? Like, you're definitely not like bloated, or like you didn't eat too much chips tonight. Like, so kind of bringing it in that way. It's always nerve-wracking, but I think it's better to kind of be upfront and tell people, and just be honest.
Absolutely. And and one more question coming in from Ed in terms of having an ostomy traveling on a long road trip. So again, that's going to be a little bit of a challenge when, again, you may have an ostomy or a pelvic pouch. So have you made any long haul trips or travel experience in general with the ostomy, and tips from that?
I have. I've been to ostomy camp, I think, like 12 times now. That's only a week, so it's kind of long, kind of not. But every year I end up going. I always pack like quadruple the amount of supplies that I might actually need. So that's always a good thing. Bring extra stuff. For kind of longer trips, I did Mount Everest Base Camp back in grade 11. So I was gone for, I think it was 25 days total. So that one was like a massive thing of ostomy supplies. And for that one, because it was more of a third world country, you can't just say run to a pharmacy and say, I just need an ostomy bag, like I need anything. So that one had to be prepared. I packed so much stuff, so many extra Ziploc bags, everything that I could possibly need, I brought with me. For that sense, I know I had a friend from ostomy camp that went backpacking around Europe, and she had designated spots throughout her trip, so that with a mailing address, so that her parents could actually mail supplies over to Europe for her, so that she didn't have to backpack with like half a backpack full of ostomy supplies. So that's also an option. Looking into pharmacies or kind of ostomy dealers wherever you're traveling to, and seeing if they'll order some supplies in for you, or just even knowing that they're there, that there is something available.
Yeah, I think preparation is key when it comes to travel, and even like long road trips, if that's the case, just making sure they have adequate supplies to deal with any challenges that may come up along the way. And a comment here from Tina, who just did a trip to Italy and Greece, made sure she carried supplies with me on the plane, but never had an issue. And again, just good comment, don't let an ostomy hold you back. And I think one bit of good advice, maybe if I can slide in there, if you do have ostomy supplies, don't pack them in your checked suitcase, but in your carry-on. Just make sure that you have them at the ready. I'm pretty sure Tina did that, and anyone who had an ostomy would have that forethought, but
I pack in both, just in case. So that if one happens to get lost, I have it in the other. Another big one is watch if you bring ostomy scissors, because the security will take it away from you. I was heartbroken one year when I went to camp and they took my scissors away, and I had to leave them in Hamilton and not bring them to Calgary. And I had not had any of my flanges. So could have been an issue if I wasn't going to ostomy camp. I don't know how many people have tried to cut ostomy bags with regular scissors, but it is quite a bit more challenging than with the specialized little scissors.
Understandable. But yeah, that's a good point actually on the scissors. I didn't actually think about that, but that might be a challenge in the day and age that we now live in. But hopefully, people are a little bit more understanding about the fact that you're using it for a medical necessity. So now, a couple of last questions as we get close towards the end. And again, please keep your questions and comments coming in through Facebook. So someone who may be on the verge of having surgery for an ostomy, what sort of tips or advice would you give someone who's maybe thinking about it or may see it in their future?
I would say reach out to people if you know anyone that has an ostomy or, attending this lovely Facebook Live event. Kind of finding your resources. So obviously the Ostomy Canada Society website, Crohn's and Colitis Canada also has resources. Vegan Ostomy, who's on here right now, I'll give him a shout out.
Free publicity, Vegan Ostomy.
People on YouTube that also have a lot of information about ostomies and their personal experiences. And kind of finding those resources and really kind of learning what they go through, any of their tips and tricks, and kind of what to expect having an ostomy afterwards. It is, in a sense, it's life-changing because it's changing the way that you go to the bathroom, but it really doesn't change anything else in your life. So I think once you kind of realize that and see maybe the potential health benefits that you're going to get from it, or at least the improved quality of life, it makes the transition to actually having surgery and having an ostomy quite a bit easier.
Thank you again. Excellent advice. Getting to a few more questions again, just from folks out there, and sorry that we couldn't get to all of them, but thank you for sort of discussing amongst yourselves and answering questions before we even had a chance to get to them. So you guys are really on the ball in the comment section today. One question that came in a little bit earlier, an area of conversation that's seldom discussed is ostomy reversal. So again, getting back to the whole pelvic pouch and J-pouch surgery option. So it would be nice to hear from people who've had a successful reversal. So I guess that would be me, and from people who had a reversal and it did not work and went back to a bag. So Blanca, first of all, I do know someone who did have a pelvic pouch, had it for about 10 years. It didn't quite work out very well, had recurring pouchitis, went back to a permanent ostomy and has been living very well since. I know he likes to specifically note that he drinks beer and eat wings on a regular basis, and he's fine with it, and that's a result of the ostomy. And he goes skiing and he does all of the normal life activities after having the pelvic pouch, and after going back to the ostomy. And just speaking for myself, I did have a successful reversal. It's been 4 years now that I've been living with the pelvic pouch, and everything has been very good since. Obviously there was a little bit of a adjustment period after the second surgery in my case. So getting used to the new plumbing and getting used to the frequency of trips to the bathroom. But, in general, I go to the bathroom more often than other people. And that's really the only other thing that's kind of different from my day-to-day life. I'm still lucky enough to be working here and working for an organization that I care about, and still able to contribute and do physical activities and travel and all the other good stuff. So I think there are a lot of great stories out there from people who have ostomies, people who have pelvic pouches. And just one last note, that a friend of mine who has a J-pouch as well made a good point to me to say that you may see on the internet a lot of bad stories about people who have ostomies or pelvic pouches. And don't let that cloud your judgment here, because a lot of the folks who have an ostomy or have a pelvic pouch, they're doing really well and they're out living their life, and as a result they're not spending as much time on the internet writing about it and talking about it. And I guess that's the job of folks like me, to tell those better stories, and that's what we're hoping to do here today with myself and Carly. So again, thanks for that. And a great again, more self-commenting from folks in the comment section. So there was a question about having a pregnancy while having an ileostomy. So we got a response to that question from Tina. Had both of her children with an ileostomy, just had to be a little bit more careful with what she ate. Oranges, had to be careful. So I'm guessing for whatever reason, maybe oranges didn't quite agree with her. So again, is it possible to have an ostomy and be pregnant? Yes, of course.
Yeah, for sure.
And Tina is the proof.
Haven't done it, but
and we won't get into
it. But I know a lot of people that have, and it's been really successful for them.
Excellent.
No real ostomy related issues. It's more the classic pregnancy kind of symptoms that I've heard. The only big ostomy one that I've heard of is when you're in kind of your third trimester and you're feeling really huge. You sometimes can't see where your ostomy actually is. So you need like a partner or a friend or someone to actually change your ostomy bag, because you can't see your stoma anymore, or like have mirrors set up somehow. But you make it work, right? So,
absolutely. you go to a fun house and find those house of mirrors, and then you make it work by making your ostomy change there. Perfectly acceptable behavior. Some other questions. One from Cheryl. Swimming in, say, a chlorinated pool versus an ocean. So would chlorine potentially have an effect on the wear time or the seal on an ostomy appliance?
I haven't really noticed a difference between swimming in a pool versus swimming in an ocean. I know when I first took those swimming lessons way back when, the ostomy appliances were not as high tech as they are now. So it did eat away quite a bit. That being said, those products are all discontinued now, so you can't even buy them. So I don't find that it really wears away. It sometimes peels up a little bit. I also get that sometimes in the summer when it's really hot and sweaty and muggy in Ontario. But some kind of tricks or tips that you can use, make sure you're changing out of your bathing suit right away. So the faster that kind of skin and that flange dries, the better it'll stick again. If it's kind of sitting wet, it's going to stay wet and not stick as much. There's a bunch of products out there. The one that immediately comes to mind is the Sure Seal rings. So it's kind of like the Tegaderm that they put on your IV, just a clear piece of plastic that's literally in the shape of a donut that can go around the flange and kind of waterproof and seal proofs everything there. You can use Tegaderm. Some people just use like a regular kind of medical tape or a waterproof tape just to kind of provide an extra barrier layer to their ostomy flange.
Excellent advice. And some other good advice that came up again in the comments. So we mentioned earlier about having scissors to cut the holes in your flange and maybe having troubles getting past airport security. So from Vera, use a small hole punch to cut my flanges. Found it on Amazon much easier than scissors. So a small hole punch, maybe punching multiple holes to get the size right. That's a really good tip. I hadn't ever thought of that. And,
no, I hadn't either, to be honest. Some drugstores will also pre-cut them for you. So they have like their own size hole punch and you can get them to cut them for you. So
also good advice. And from Blanca, who's had a colostomy when she was 69 years old. And right now leading a very good life, exercise, trekking, avid bike rider, and other than the occasional mess, little accidents do happen. Life is grand. I can't complain because I know others have it worse, so I'm extremely grateful for my good life. Thank you so much, Blanca, for sharing that with us, and great to know that you're doing well with your ostomy. Just trying to get caught up on all of the other comments that have come in. And there have been a lot, so thank you again for that. And just one last one, I guess, in terms of, we've had a lot of great comments here. If you have more questions about living with an ostomy, looking for more advice, Ostomy Canada Society is a great place to go to. Their website, ostomycanada.ca, is full of resources and, again, hopefully some communities near you where you can find more information. And as well from our website, which I will type in slowly and then put up on screen, crohnsandcolitis.ca. For more information as well about living with an ostomy, and local chapters have a lot of great people that are there willing to talk about living with an ostomy or a pelvic pouch. So I think we're at the point now where we just want to wrap up and say once again a big thank you to Carly Lindsay for sharing her time and all of her experience, and all the best with your next nursing designation. I hope that the ET nurse designation does come through. I feel like you're more than qualified for that.
Good. We're getting there.
And for everyone, again, who left comments in today, thank you so much. Maybe once we're done the live broadcast today, we'll try to answer some of the questions as well, just in the Facebook comments thread. But thank you for taking the initiative to answer some of the questions already before we even had a chance to. So again, for all the participation tonight, thank you again. And the recording of this will be up on the Crohn's and Colitis Canada Facebook page as well, so you can watch it at your leisure whenever you like. So thank you all for joining tonight. Thank you again, Carly, for being with us, and we'll talk to you again soon. Thanks, everyone. Have a good night.
Thank you.